first let me preface that I was the chair of the New Hampshire Developmental Disabilities Council when we recognized you for the outstanding legislator that you are.
Thank you.
You're quite welcome. Second, my question is managed care.
Yep.
Area agencies, the wait list.
Yep.
Where do you stand? Because we could do a huge backslide.
Yeah. We could do a huge backslide, especially if this group stays in charge in Concord and keeps cutting and cutting and cutting budgets. I think the managed care proposal that's out there is still a little bit fluid, and I think they're understanding, in the executive branch at least, that it's a much harder thing to do than they thought. So I don't quite know what proposal they're going to end up with. And I will say that I think what I am learning about it makes me concerned that it's managed care with the intention of just denying services to a lot of people, as opposed to managed care to improve systems and service delivery and reaching some efficiencies that I think many people who receive services might agree could be accomplished. And so I think there's always a balancing act. I think none of us should stay static in a system. No matter how well it's been working, you always should re-examine how things work and whether there's a better way to do them. And so I think there are people in Health and Human Services who are trying really hard to do that. But I'm concerned about this proposal partly because I think people are just counting on a financial savings as opposed to true systems improvement.
And where mental health is concerned, and now with the United States Justice Department stepping in to support DRC legislation,
Yeah.
What's going to happen? Does anybody have any logical common sense to figure out if we would have stuck to the plan for the mental health community centers years ago and moved forward instead of either backslided or stayed static, we wouldn't be here now? What could possibly happen? Because that's scary.
Look, it's scary on a lot of fronts, and I am not fully up to speed yet on the terms of the lawsuit. But certainly I favor community-based services, and I think we all know that model works better. But achieving it and doing it well and right is something we're all going to have to work on together. And what we're seeing are the usual, unfortunate swings in history, which is as budgets get tight, if you don't really insist on community-based service and recognize the needs of people with mental health issues or with disabilities as civil rights issues, you can lose ground really fast.
Consumer-directed services works.
They do, thank you. That's a good way to put it.